Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in a polycystic ovarian disease, all of the following are seen except in polycystic ovarian disease, you will see increased FSH and streak ovaries are not seen. What are seen in polycystic ovarian disease? Endometrial carcinoma, insulin resistance and hirsutism are seen. Increased FSH is not seen. There will be decreased FSH. Streak ovaries are actually seen in Turner syndrome, not in polycystic ovarian disease. Then all are true about polycystic ovarian disease except in polycystic ovarian disease there is persistently elevated LH, there is increased LH by FSH ratio and there is increased dihydroxyepiandrosterone. Prolactin is not increased in the patients with polycystic ovarian disease.
Prolactin is increased in hyperprolactinemia.
thank you and thank you for watching.